Diabetes mellitus is an endocrine disorder, characterized by high blood sugar levels. It may be due to either pancreas not producing enough insulin, or body cells unresponsive to it. Two types, type 1 and type 2. In type 1 diabetes, insulin completely deficient, but in type 2 diabetes, insulin present but resistant. Gestational diabetes, sudden spike in blood glucose during pregnancy, common in second or third trimester. It resembles type 2, requires throughout medical supervision, transient and fully treatable. Let's dive into some anatomy and physiology. Pancreas is an organ and digestive system, which has exocrine and endocrine portions. As an exocrine gland, it releases digestive enzymes. Pancreas produces insulin from islets of Langerhans. Carbohydrates converted into glucose as part of digestion. When glucose rise in blood, insulin released to bloodstream. Insulin transports glucose inside cell for metabolism. When glucose goes inside cells, glucose level in blood reduced. Excess glucose converted to glycogen in muscle. Glucagon work as a counterbalance the actions of insulin. Signs and symptoms: polyphagia, polydipsia, polyuria. Polyphagia means excessive hunger, which is due to lack of glucose in the cell for energy. Polyuria is excessive urination, which is due to kidney produces extra urine to filter out excessive glucose. Polydipsia, excessive thirst, it is due to increased urination. Diagnosis: fasting blood sugar, oral glucose tolerance test, glycosylated hemoglobin or HbA1c. Management: diet, exercise, oral hypoglycemic agents, insulin. Please watch detailed insulin video from Nclex or N playlist. Hypoglycemia. It occurs when there is not enough glucose in the bloodstream. Symptoms are due to sympathetic stimulation, often presented with cold, clammy skin, confused, nausea, headache, hungry, blurry vision. Management: provide 15 grams of carbs, 150 milliliters orange juice, or for big glucose jelly beans. Wait 15 minutes and check blood glucose again. If still glucose below 70 or 4 milliosmol, provide another 15 grams of carbs. If the client is unconscious, push dextrose 50 or in glucagon. Transport immediately to emergency. The dawn phenomenon is a normal rise in blood sugar as a person's body prepares to wake up, but not enough insulin to act. Develops between 5 and 8 a.m. Treatment: administer evening dose of intermediate-acting insulin at 10 p.m. Somogy phenomenon occurs when normal or elevated glucose level present at bedtime. Hypoglycemia occurs between 2 and 3 a.m., causing increase in production of counter-regulatory hormones. Treatment is increase evening dose of intermediate-acting insulin as prescribed. Chronic complications: diabetic retinopathy, diabetic neuropathy, diabetic nephropathy. biguanides, metformin. Lower blood glucose levels by reducing hepatic release of glucose. Side effects: GI disturbances, lactic acidosis. Thiazolidinediones, known as glitazones. Increase insulin receptor sensitivity. Monitoring for hepatotoxicity. Sulfonylureas. They close potassium channel and opening calcium channel, thus insulin secretion increases. Meglitinids. Closing potassium channel and opening calcium channel, thus insulin secretion increases, different binding site from sulfonylureas. Alpha-glucosidase inhibitors. Lower blood sugar levels by blocking the breakdown of starches in your intestines. DPP-4 inhibitors. GLP-1. This stimulates insulin production and decreases production of glucagon when glucose levels are high. SGLT2 inhibitors. They block reabsorption of glucose into the renal tubules, promoting excretion of glucose in the urine.